Hello, it's Dr. Rhonda Johnson, and today is Saturday, March 27th, 2021. COVID-19 infections are on the rise again, so today I thought I would do a review so that we would remember what the symptoms are of COVID infection. Now, I know no one thinks they're going to get it, and many people assume if they get this infection that they're going to beat it. Now, we know that some people just get a cold. Some people have very few symptoms. Others get extremely sick, and some folks will die. It has to do with your immune system and probably how much virus you get exposed to and get infected with. Remember that men seem to get sicker than women, and children seem to get less sick than grown-ups. So, just to review, once you get infected with the SARS-CoV-2 virus, that virus that causes COVID, keep in mind there are distinct phases of this disease. The early or initial phase occurs in the initial stages of infection, and the disease is primarily driven by replication of the virus, which usually starts in the nose and the throat. Again, sometimes people have no symptoms, but when they are symptomatic, the common symptoms include fever, body ache, dry cough, feeling tired or fatigued, chills, headache, sore throat, loss of appetite, loss of smell, and then stomach problems like abdominal pain or nausea or diarrhea. Most children who get infected with COVID-19 have either no symptoms or mild symptoms. They may have low-grade fever, fatigue, stomach ache, decreased appetite, and cough. Kids are also prone to have a rash, especially on their toes, and that's why they call it COVID toes, a purplish-looking rash that appears on the toes. Remember that on average, the time from exposure to the time of symptoms is about 5 to 6 days. Remember that the virus can be spread in saliva, semen, and in the stool. In some people, COVID-19 causes more severe symptoms like high fever, severe cough, and shortness of breath, and that usually indicates pneumonia. COVID-19 can affect brain function in some people and neurological symptoms, and that can include a loss of smell, inability to taste, muscle weakness, tingling or numbness in the hands and the feet, dizziness, confusion, delirium, seizures, and strokes. Now, for some people who go on to develop more serious disease, usually occurs in the second week because the body is mounting an exaggerated immune response and inflammation in response to the virus replicating in the cells. This can lead to major complications, and sometimes multiple organs are involved: the heart, the brain, the lungs, the kidneys, and even the pancreas. Folks, it's very important to get a diagnosis sooner as opposed to later. You can get free testing in many places. It's best to contact your local health department website or either contact your PCP, your primary care doctor. And in many states, CVS, Walgreens, and Rite Aid offer COVID testing. So remember, get tested early, keep track of your symptoms, write down the days that your first symptoms appear, and things to have in your house include fluids, because hydration is very important, something for fever control, Tylenol or Motrin. And remember, you have to keep the sick person away from everybody else. And folks that are in the house should be wearing a mask when they're in contact with that sick person. If you have to, take the food or assist in caregiving, people in the house need to wear a mask. Do not share eating utensils. It is okay to share the laundry. Now, for people who have chronic diseases, remember to always be in contact with your doctor. In the early stages of these infections, there are treatments such as monoclonal antibodies that can be given to people 12 years and up that are high risk for COVID disease progression. That has to be given by IV in the emergency room, and it can only be given early in the infection. So your doctor will need to coordinate that with you, and you have to have certain conditions. Don't wait too late. If you're experiencing severe symptoms, don't wait till it's too late. If you're experiencing shortness of breath, high fever, severe cough, confusion, inability to maintain fluids, you may need emergency room evaluation or hospitalization. So that's my message for today. We'll be talking about, again, how to care for loved ones at home. I'm going to be doing some review of the basics of caring for someone for COVID in my next video. In the meantime, the best COVID infection is the one that never happens. Keep wearing the mask, keep washing your hands, keep socially distant. Know that cases are on the rise, and in many cases it's due to these highly transmissible variants. As always, my views are my own, and have a blessed day.